Okay. I'll just be quiet for now.
Show the love. I can't count the times I almost said what's on my mind, but I didn't.
Hi, everybody.
Just the other day, I wrote down all the things I'll say, but I couldn't. Just couldn't.
Got a little Joe Nestor to take us into tonight's show.
Oh, so here goes nothing. In case you didn't know, baby, I'm crazy about you.
Hi, Corey. Hi, Bonita. Hi, Kevin. What's up? Hi, Amy.
Even though I don't tell you all the time, but you had my heart a long, long time ago. In case you didn't know. The way you look tonight, that sucking glass of wine.
Please share this out, guys.
There was something about that kiss, girl, it did me in. Got me thinking, I'm thinking all the things that I've been feeling. Oh, it's time you hero. In case you didn't know, baby, I'm crazy about you. And I would be lying if I said that I live this life.
Hi, Amber. How are you? It's good to see you on here.
I don't tell you all the time, but you had my heart along. In case you didn't know, you got all of me. I belong to you. You're my everything. In case you didn't know, crazy about you. And I would be lying if I said that I would live this life without you, even though
Hi, Tony. Good to see you on here. Hi, Angela. Okay, everybody, that was Joe Nestor doing a cover of Brett Young. In case you didn't know, I want to give a shout out to Joe Nestor, Nestor Nation. Love and appreciate you and your music, and we stand behind you here at No More Heroin. Thank you, everybody, for being here. The Survivor series is an original product of NoMoreHeroin.org, and we usually showcase success stories in recovery, people that have overcome seemingly insurmountable odds to have a life of purpose and destiny. But tonight we have an amazing guest from Long Island, New York. That's correct. This would be an educational segment, and hopefully it will help educate and just give some awareness about some other treatments for trauma, addiction, mental health disorders. The brain is a very, very complicated organ, and it's highly misunderstood. And I think part of our recovery program is about educating ourselves about what's going on with our body and how we can combat the self-sabotaging and self-destructive tendencies we have within us. So with that, I want to bring you guys and welcome Dr. Stacie Locacio. Thank you, Doctor, for being here.
Hi, thanks for having me.
It's truly an honor to have you here. There's no question so far, but your specialty, you are a doctor of chiropractic. You're a chiropractic doctor. get tongue-tied with that.
Yeah.
But you are also a certified neuro. I got it wrote down. Neurofeedback professional.
Yes, that's correct.
When somebody sees the word neuro, what does that mean?
Well, it means it's connected with the nervous system in some way, shape, or form. And in particular, this is the central nervous system, and more specifically, the brain. So this is about feedback from your brain to your brain, essentially, and to help you understand what's going on. The same way biofeedback could let you know what's going on with your heart rate. Neurofeedback will let you know what's going on with your brain.
Awesome. We know that addiction is a disease of the brain, and the brain is one of the major organs in our body. And with the drugs traveling through our blood system, it travels through our brain and does a lot of damage. But in addition to that, the brain suffers from trauma, for different reasons. For people it's from the lifestyle and their activities and being put in dangerous situations. But for other people, it could come in the form of PTSD and other traumatic injuries to the brain. What is your specialty with the brain? What population do you see the most?
Population I see the most is actually teenagers. And I'm glad that I do, because I think that getting your brain straight before, in most cases, you can get involved in or become into a lifestyle where you can become addicted. Because I think some of these kids may have sought to self-medicate had they not come across this.
Absolutely.
Or may have been treated with medications that could lead to trading medications down the line or something like that, and end up getting into what you're fighting.
Absolutely. So there are different aspects to your specialty, and I think the first aspect and tool that I would like for you to cover is what is brain mapping and what does that entail?
Okay, brain mapping is an electroencephalogram that tells the computer really what is going on with brain waves in different areas of the brain, and what is going on with certain other aspects. There's brain waves, there's interconnectivity, there's which brain waves are dominant where. It can let us know if your map presents a picture of somebody who might be depressed, or somebody who might be anxious, or somebody who might have ADHD, or somebody who may have undergone some trauma in the past. And trauma can be physical. It can be something like having had a severe illness, like an infectious illness, and survived. It can be having broken bones and hit your head. It can be abuse. It can be a lot of different things.
Okay. When you do the procedure for the brain mapping, what does that look like?
It's what I like to call the silly hat. It's like a bathing cap with a bunch of plastic discs that go through it, and a bunch of wires coming out from the middle. And
it's like something from a science fiction movie, or Back to the Future.
Right. Right. It is something like that. Well, it's not metal, so it's not like that guy's hat.
Right.
But it has the discs, and I put through gel with something that looks like a big needle, but it never pierces your skin. And the gel helps us read what's going on just underneath the skull in terms of brain waves.
Okay.
They penetrate outside, so you can read it from outside. Fortunately, because if you couldn't, it would be a much bigger procedure.
So it's reading the different brain waves, but is it also reading the different regions in the brain?
Yes, it's reading brain waves in the different regions of the brain. I do it in my office. It's a 12 site. So it would be, here and here, and then front right and left, central right and left, parietal right and left, temporal right and left, and in the back, the occiput right and left.
What comes to mind is like when you have your heart tested, they put those they attach those probes around your heart to read your brain or your heart pattern. It's the same concept for your brain. Is that right?
Yes.
I mean, kind of.
Same concept. Yeah, it's the same concept. Except we don't get brain waves at the ankle. I don't know how they get stuff at the ankle. I guess they must do something to have some. It's like a ground. That's a ground at the ankle.
I think it's a ground. Yes.
Same concept.
So what are there different types of brain waves that you're reading when you're doing this that paints this picture on what actually is going on inside the brain?
Yes, we read four different brain waves. They're at different frequencies. That's what defines them. We have delta, theta, alpha, and beta. Okay. Those are the four types of brain waves that we delta being the slowest, theta being the slowest, beta being the highest, and then high beta, that's somebody who vibrates at a very high frequency, or whose brain fires at a very high frequency rather more than vibrates at a high frequency. And
does that be somebody that's hyperactive or ADHD?
No, ADHD is a little more complex picture. That's somebody who's anxious, hypervigilant, ruminating, worries a lot. That's that type of picture.
Okay. So when this picture is taken of all these brain waves, what are you reading, and what can you decipher from that? Can you tell trauma, or can you read? Can you get a diagnosis from that? Is what I'm asking.
Not really.
Okay.
It's not diagnosis. Brain neurofeedback, from my perspective, is not really diagnosis oriented. You don't have to come to me with a diagnosis. You can just say, I feel this. You don't even have to tell me anything. I want to do neurofeedback because I want to improve my brain. Hi, Sarah. Thanks for listening. Kim, thanks. Wow, all these comments come up. Oh, okay. So it's not really based on a diagnosis. The diagnosis is of the brainwave, and the computer actually tells us, because it's a very complicated logarithm, and the computer tells us what protocols basically it suggests. And my expertise comes in determining which one of those based on history that you give me. But history does not necessarily equal diagnosis.
Absolutely. There's a lot of mitigating factors, that go into a diagnosis, and
absolutely,
you're taking the statements. You're taking a lot of information from a patient or client that really doesn't know what they're really feeling or what's really going on in their life, and they may not be telling you the whole truth. So you may have to decipher, during the process. I'm pretty sure.
Right. Or it's relying on a diagnosis of another practitioner who may not have seen the entire picture as well, or not have been given the entire picture as well.
Absolutely. Yeah. I mean, not every professional is good at their job either, I would say.
Diagnosis is a very complicated thing. It's not, it's not simple. If it was simple, everybody would do it.
Absolutely. So
second opinion.
After you've gotten this picture from you got this map of the brain. What is the next step in your process from that? Did you implement that information and put it into a program to come up with a corrective action, if you will?
Yes, that's all done automatically as the map is being read, as the map is being taken. As a matter of fact, the computer program. That's what the core of the whole different systems are.
You got your microphone covered or something.
Oh, okay. That's what the core. Sorry, that's what the core of the different programs is the software, and the software analyzes it and comes back with the suggested protocols, and we'll look at the protocol, and we'll look at not just the brain map but the more clinical picture, and determine which protocol of the two suggested protocols would be best. And then we start with that and actually get into doing neurofeedback.
Okay. The next step in the process is the neurofeedback, right?
Right.
Which
Feedback protocol.
could you describe what that is, what that means, and how that's done?
Okay, neurofeedback is, from the patient perspective, extremely simple. You would come into my office. In my particular office, I have a recliner, I have a blanket, I have phones, and you tell me what it is that you want to watch on Netflix or Hulu and some other streaming service. I think I have HBO Now or whatever. And you tell me what you want to watch on that, and I put it on for you, set you up with two sensors pasted to your head and ear clips pasted to your ears. And that's my cat. She's distracting me. I'm sorry. And the ear clips pasted to your ears, and you sit there, you recline, you have your blanket, or you have a weighted blanket for anxious or hyperactive patients if they wish.
Mm-hmm.
And you sit there and watch TV for half an hour. Very strenuous.
Yeah. So what is happening? What is happening during this process?
The actual feedback procedure is coming through your eyes and through your ears, because as you're watching, as your brain is doing what the protocol wants it to do, you can see and hear the program. But if you deviate from that, which you will, because that's the procedure to learn how not to deviate from it. So as you deviate from it, the volume will drop and the brightness will drop, and your brain searches for ways to make it so that you can see and hear it. We'll search for ways to make it so that you can see and hear the program, and it'll go back and forth from the volume low to the volume up, and that's your job. Make it play bright, make it play loud.
No kidding, that sounds really cool.
It is,
and it's all done through the power of it's a thinking process, right? And when this happens, new neural pathways are being formed. Is that right?
That's right. Neuroplasticity in action.
So that's a healthy neural pathway for those. It takes the place of those other dysfunctional ones that happen during those times of trauma, mental illness, or addiction, right?
Exactly.
That's sweet. I like that. I need that. I may come to New York and catch a session with you.
You have to stay a while. Although I could do alpha theta. That's another type of neurofeedback. Alpha theta, deep meditation, and it heals.
I'll come out and do a live while I'm going through it.
Oh, cool. That would be fun.
with a cap on and everything.
That would be fun. Yeah, we can do a brain map on Facebook Live.
That'd be sweet. I mean, that would be more illustrative, I think, and easier for people to understand. So say a person has PTSD and other mental health diagnosis, because my population, the addicted, the alcoholics, the abused, whatever, have suffered trauma, but we also many of us are dual diagnosis with mental health illnesses. Mm-hmm. How can this procedure help heal those people?
Well, if they have a brainwave issue, which I assume most of them do, if they have a brainwave issue,
yep.
To answer that question, yes, it does get better as they progress, because that's one of the things that we address is depression, and it's a chicken egg. Is the addict depressed Absolutely. Because they're an addict, or were they depressed and did they self-medicate and become addicted? Mm-hmm. That's the chicken egg question. We address all of it at once.
To me, it doesn't matter. What matters is fixing the problem. No matter how you get here, you're still here. Right. So let's figure out how to fix this issue so we don't return here again.
That's correct.
Is that correct? Hey.
That's to be avoided at all costs.
Absolutely. I'm sorry. I think I threw you off topic. I was just wondering how this procedure could help with people that are dual diagnosis, that have trauma issues and mental health issues in this, we're a complicated population of people, the addicted.
Yes, I'm sure. Because I'm sure, as I stated to you earlier, that most start out self-medicating,
Yes.
knowing that there's a better way to be than the way that they are, or ruminating on whatever trauma it was that got them there.
If you would please explain that term, ruminating, for those that don't know what that is.
Ruminating is when you have a thought that goes through your head that you keep thinking about. Right, it keeps playing like it's on a reel.
Mm-hmm. And it's obsessing on something.
It's a little short of obsessing.
Okay.
It's a little short of obsessing. It's somewhere between it doesn't bother me and obsessing.
Okay. Still too much.
Right.
Too much thought goes into it. Okay, so if a person is just has a straight mental health diagnosis, how can the brain mapping and the neurofeedback help that person deal with their mental illness?
Well, mostly we see people diagnosed with things like anxiety and depression. I mean, I don't treat schizophrenics necessarily, or anybody on that, that side of it. I treat them more on this side, people who haven't necessarily lost touch with reality, but have issues that are bothersome to them, such as depression, anxiety, those kind of things, the obsessive disorders, OCD, attention deficit, ADHD. And in most of those, we see a certain brainwave pattern, and we can affect it through the feedback. So that's how we do it. And it takes time. It takes about 20 visits. Every visit or so, you may feel calmer, and you may feel a little more mindful, and you may feel more able to take just that momentary step back.
Mindfulness. That's what I wanted to get into. How does this process help us with our mindfulness? Is it about our ability to focus? Shutting down that excessive chatter and the misfiring of our neurons or whatever there is in our head?
Yes, to some degree, yes. It helps us. It's a more of a relaxed feeling that you're not as your brain's not cluttered up with stuff that you have to sort of do something immediately. It's just like a sort of a calm that comes over and helps you take a moment.
That's all I've ever really wanted, was that sense of peace and ease without having to put chemicals in my body, to be able to sit and feel comfortable in my own skin. It's been a long process for me to get to where I am. So if I would have found this sooner, I would have tried to investigate it just to see what the end result is. Rita Sellers asks, what are the statistics of this process working? That's
a question I don't know the answer to, because it depends on what you come in with. There are there's a lot of research out there on it. Generally, it's statistically significant as far as, and it's subjective. So it's hard to get statistics on something that's completely
absolutely. It's that a lot of these statistics in the there's no real way to chart it, because who gauges success?
Exactly. But most patients come out of it saying, most of my patients come out of it saying that they feeling better, and that most of the things that they've come in with have been addressed to their satisfaction. So I can't ask for more than that.
Any type of improvement and creating that sense of peace and ease is an improvement for an alcoholic or someone that's got PTSD, so that that they can implement other tools and be successful. Having a firm footing or ground to try other things is very, very important for anybody.
There's a question up here I want to address. Can I make the brain believe that you're not feeling pain? The answer to that is no. And that would be I mean, it does address, it can address some forms of chronic pain, like fibromyalgia or something like that, but it can't make the brain believe that it's not feeling pain. And the way that the question is posed, it would be a very dangerous thing to do, to mess with, not being able to feel pain, because pain is there for a reason. It's to let you know something's going on.
What is hypnosis? Is that a real procedure, or is that hokey, in your opinion?
There are people who can probably be relaxed into a maybe a somewhat suggestible state. But I'm good, Rita. I'm glad, but I'm not sure about it. I'm not an expert on hypnosis at all.
I just kind of randomly threw that out there.
Yeah.
I didn't know. It's like Bradley also asked, can you make the brain not desire nicotine or drugs?
Nicotine, I don't know about, but the drugs, it has some success with addiction. Yes,
Absolutely.
it has some success in breaking the cycle of addiction.
Reading Eckhart Tolle. Let me see. Paul Rosenberg. I'm grateful you're here. Paul has a lot of time in sobriety, like 35 years. He is from the New York area as well.
Oh, okay, a neighbor.
Yes, reading Eckhart Tolle, The Power of Now. Excellent read. Pulls me back into the now, not yesterday, not tomorrow.
It's a good place to be.
Yes, ma'am.
Borrow trouble from tomorrow.
I'm not sure. I don't know if you can answer this question or not, but my friend Sarah wants to know how long does it take to diagnose a brain mental disorder? Does it matter on the particular disorder? I think is that like a psychiatric question?
Yes.
Kind of out of your wheelhouse?
Yes. I don't diagnose disorders. I diagnose brain waves, and I determine if brain waves. Hey, Staten Island.
Paul's a good guy. Yeah.
Relatives in Staten Island.
Let me see. After we covered the neurofeedback. I find that interesting that when you're watching something and it has you focusing on the screen, and then the volume starts going down, and you start thinking about it to try to make the volume come up. It's like, it's almost like telepathy or whatever, making your brain work, or I think I can.
Make your brain work.
That's so great. Cool. The brain is such a complicated, fascinating organ.
The most interesting part is that you don't have to think about it. All you have to do is watch. You just watch, and your brain just knows that you want to watch this, and it has to do its best to get you to be able to see it and hear it.
Very cool.
Very situations that it has to change things in order for you to be able to see it and hear it, and it does.
That's basically rewiring your brain for success.
To some degree, yeah.
That's an excellent thing. I don't see anything negative about that.
There isn't. There really isn't a downside.
Are there
a downside to doing it?
We had when talking earlier, we had talked about the EEG. What is that exactly, and how do you incorporate that into your treatments?
That's an electroencephalogram, and that's the exam that we do with the silly hat, with the futuristic-looking bathing cap. And
reading the brain waves.
Reading the brain waves, and that's what's put into the program, into the software, and that's what the software reads. And the software will give me a read, and it'll give me a protocol or two, a choice of two protocols of what to do. And I also look at it and determine, and I'm able to tell the patient, oh, you see, you're telling me you have anxiety. This is part of the reason why you have this beta wave pattern, or you have depression, and this is part of the reason why you have this alpha wave pattern. And we're going to work on these, and we're going to try and get these switched around a little bit and help you feel better.
Awesome. I mean, I really think I may need to take a trip to to New York. Because I'm not too sure sometimes there's any activity going on up in there. From what you know of the brain, do brain cells rejuvenate, or would you say no?
They're not supposed to. The brain cells themselves, I don't think do, but what they do is they find new pathways and workarounds. And the younger you are, the more workarounds your brain will find. So if you have, God forbid, an aneurysm or something as a child for whatever reason, or stroke, you're going to be much better able to recover because your brain is has much more plasticity to it. But there are recoveries, and especially if you work on it, if you go to physical therapy, occupational therapy, challenge yourself neurologically, all those kinds of things, that will help to build new pathways and workarounds for what's not there, what you're lacking.
Okay. And I think that I've seen some people with TBIs, traumatic brain injury, that recuperate quite well and are very, very functional. And I think it's a matter of exercising, doing these things, exercising, the good portion of your brain, and it compensates for the other.
Right. It actually does literally find ways to work around what's been lost.
It's very cool.
It is.
How can people find you if they're in the Long Island area?
I'm on Facebook, Dr. Stacie Locacio, or my regular page, Stacie Locacio. You can reach out to me either way, my personal or my business page, or my phone, text or call 516.
Hold on, I'm typing it out into the comments. 516.
Yep. 903.
903.
4599.
4599. Boom, there it is.
That way, or shoot me an email.
Email?
Email first initial dot last name. So it's s.locascio.
Locascio, okay.
There's 2 C's in it, LOCASCIO, at optonline.net. That's opeterthomasonline.net.
Hold on. Peter
Thomas.
Thomas. Net. OPT.
ONLINE. Are you typing on your phone? Didn't realize.
Yeah.
I have a regular keyboard in front of me, so I'm thinking he's typing it on a keyboard.
No.
Optonline.net.
Online at, one more time.
At optonline, OPTONLINE.
.net.
Right.
Gotcha. There we go. You guys hit her up if you got any questions, anything that we haven't discussed. Is there any other information?
Tomorrow. It's getting late.
Tomorrow. Yeah, I really appreciate you taking the time to do this. I know you have a busy schedule. You have a lot of personal things going on that you're trying to accomplish. So I won't keep you much longer or any longer.
It's fun.
Is there any? Yes, thank you. It's an honor. You having you as a guest, adds credibility to what I'm trying to do with my platform, and just educate and give awareness to the different aspects of treatment and helping folks. So is there anything you want to add in conclusion? Any information that I may have?
I wish all of you namaste and lifelong recovery.
Amen.
For every addict, lifelong recovery.
Well, thank you for what you're doing, and thank you again for taking the time to do this with us. I will make sure you get a copy of this. We will convert it to a YouTube video, and I had shared the announcement in other groups, and they wanted to know if there was going to be a file or something shareable for, they called it a lecture, so this you provided us with some really good information and things to think about, and helped educate me on the brain and the things that have been going on in there that I thought that I was crazy, but there is a physiological reason why I felt the way I did for so long, and it's correctable. How about that?
There you go.
How about that? I may not be such a lost cause after all. All right. Thank you, doctor. I really appreciate your time. You have a fantastic evening. Thanks, everybody, for tuning in. This is Higgy for the Survivor Series and Dr. Locascio. I'm out of here. Good night.
Good night.